Look closely at the air inside a standard workspace. With every stroke of a file, a chaotic storm of respirable dust and organic particulate matter is launched into the breathing zone. This dust acts as a vehicle for fungal spores, MRSA bacteria, and concentrated volatile organic compounds, all suspended within the environment during a routine service. Professionalism in this field requires a move toward a health-oriented model, recognizing that nail technology exists at the critical intersection of aesthetic enhancement and public health. Under regulatory frameworks like Kentucky's KRS 317A, a state-issued cosmetology license serves a specific legal purpose. It is a mandate to protect the public. The license certifies that a technician possesses the clinical knowledge required to prevent the transmission of communicable diseases and mitigate severe chemical exposures. While a client judges a service by its perfect symmetry, the technician's true skill lies in the preservation of their biological integrity. The invisible labor of sanitation is what defines professional status. To maintain that integrity, the workstation must be managed as a complex biological landscape. Every surface is a potential reservoir for microorganisms. Pathogens are opportunistic. They exploit microscopic breaks in the skin barrier, often created by aggressive manicuring techniques, to bypass the body's defenses and establish an infection. These pathogens move through the salon via a predictable chain of infection. The most immediate pathway is direct, skin-to-skin contact between the technician and the client. The secondary pathway involves fomites. These are inanimate objects like files, metal cuticle pushers, and steel nippers that harbor pathogens after touching contamination. This technical matrix illustrates the strict regulatory binary required to neutralize fomites, known as the tool classification system. It divides all salon equipment into two unyielding categories, porous and non-porous. Non-porous items like stainless steel or high-density glass have smooth surfaces that withstand clinical cleaners. They are multi-use, provided they undergo strict mechanical cleaning and chemical disinfection between every client. Porous items like wooden sticks and emery boards are absorbent. Once they contact biological fluids or skin cells, they cannot be sterilized. They must be discarded immediately after a single use. Retaining a used porous file for a second service actively breaks the chain of sanitation, transforming a standard tool into an active disease vector. The biological risks compound when water is introduced. The most dangerous equipment in any salon is the internal plumbing system of a pedicure basin. This cross-section shows biofilms, complex microbial colonies anchored to the internal walls of pedicure pipes. They excrete a protective matrix that repels standard disinfectants. A simple wipe leaves the core bacteria completely intact. Breaking this layer requires intense mechanical friction. To destroy biofilms and neutralize fomites, technicians must execute a mandatory 3-stage clinical decontamination sequence: clean, disinfect, and store. Stage 1 is mechanical. It requires physically scrubbing the implement with soap, warm water, and a dedicated brush to remove all visible debris and bioburden. If Stage 1 is skipped, the process fails. Residual organic matter, like oils or skin cells, neutralizes the active ingredients in liquid disinfectants, rendering the next step completely useless. Stage 2 is chemical eradication. The cleaned and dried tool must be completely submerged in an EPA-registered hospital-grade disinfectant for exactly 10 minutes to achieve the required kill rate. In practice, this stage is frequently compromised. Salons often succumb to the cloudy jar, reusing a neutralized solution, or they remove implements after only a few minutes to save time. Any deviation from these precise contact times creates a false sense of security. It leaves live pathogens on the instruments, directly endangering the public. Beyond biological threats, the salon presents significant occupational chemical hazards. Technicians are exposed daily to volatile organic compounds and microscopic polymer dust. This diagram compares acrylic liquids, methyl methacrylate, MMA, versus standard ethyl methacrylate, EMA. MMA is prohibited because its small molecular structure deeply penetrates the skin barrier, causing severe allergic sensitization. EMA's larger structure keeps the product safely on the surface. Mitigating these chemical exposures requires proper equipment. The standard paper medical mask offers zero filtration against chemical vapors or fine polymer dust. True protection relies on a mandatory engineering control, source capture ventilation systems. This schematic demonstrates workstation safety requirements. The system must pull chemical vapors away from the technician's breathing zone at a minimum 50 cubic feet per minute. This contaminated air cannot recirculate through a carbon filter. It must be exhausted completely to the building's exterior. Working without this sustained airflow leads to irreversible occupational asthma and permanent chemical sensitization, often ending a technician's career prematurely. OSHA-level air quality and ventilation engineering are not optional upgrades for a premium salon. They are the baseline requirement for workforce survival. We are currently witnessing an industry-wide epidemic of severe acrylate allergies, driven largely by the improper application of UV and LED gel systems. Gel products rely on precise chemistry. They contain photoinitiators, which are engineered to react only when exposed to highly specific light wavelengths. When the lamp's wavelength perfectly matches the gel's photoinitiator, it forces liquid molecules to link into a solid, inert polymer chain. The danger lies in the myth of the universal lamp. If the light output doesn't match the gel's chemical profile, this curing reaction stalls. The result is undercured gel. To the touch, the surface feels hard. However, trapped beneath that shell, the product remains in a highly active liquid state. Over the following days, these liquid, unreacted monomers slowly leaching into the client's living nail bed tissue, triggering an aggressive immune response. Treating gel application as a simple cosmetic step ignores the strict photochemistry required for safety. When equipment is mismatched, a routine service becomes a severe chemical hazard. When we observe a high-volume salon floor, the clinical standards dictated by state law meet the operational realities of a business. This intersection reveals a systemic gap between the ideal compliance taught in textbooks and the economic constraints of the working environment. Technicians are often incentivized by the volume of clients they process. This production pressure actively pushes workers to increase speed by compromising on invisible safety protocols. Under this pressure, the 10-minute chemical disinfection soak is cut short. The deep cleaning of pedicure plumbing is abandoned in favor of a quick rinse. Relying purely on human behavioral compliance will inevitably fail when pitted against the constant economic demand for speed and high client volume. To close this gap, institutions like the Louisville Beauty Academy have developed a structural solution, the compliance by design model. This model reimagines salon engineering. Instead of relying on willpower, it utilizes an environment engineered to make it harder to fail than to comply. In this model, pedicure basins are mechanically interlocked. The system simply will not allow the basin to refill with water for the next client until a full 10-minute chemical disinfection cycle is completed and digitally logged. Overhead, continuous air quality sensors monitor VOC levels in real time. If chemical concentrations spike near a workstation, the system automatically triggers higher exhaust speeds to clear the breathing zone. Paper cleaning logs are replaced by AI tracking and digital ledgers, establishing an auditable clinical standard of accountability. Engineering these safeguards into the salon floor ensures that safety is a constant. In this model, the technician manages a clinical environment where public health protection is verified by the building's own systems.